This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Is it hot enough for you? How many times are you going to hear that today? Good to have you with us as always, and we do urge you to be careful today because it's probably going to be the hottest day of the year.
John, hydration,
right.
hydration today. Please, everybody out there listening to me, please.
It almost makes you want to open up your clinic today.
Well, certainly I'm going to open it up tomorrow,
Right.
and I bet you there are going to be some people suffering from dehydration.
Yes.
Yeah.
Good to have you with us as always. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates located in Marlton, New Jersey. And today on the show, as we do every Sunday, we talk about the who, what, when, where, why, and how of Innovative Medical Associates and how it can potentially help you and your family improve your overall quality of life. And that's what we talk about here on the show. And as always, we welcome your participation at 855-839-1210, 855-839-1210. At any time during the course of the show, if you have a medical challenge, you want to run by Dr. Molly, feel free to pick up the phone and call us at 855-839-1210. You mentioned hydration, and, of course, that's the cornerstone
Of what we do.
of what you do.
Yeah.
And obviously it's more important in this kind of weather, but it's important all year around, right?
I like to say it's important all year round, but it's certainly more urgent in this kind of weather, particularly for folks who are over, 45 or 50, and folks who I see on a daily basis who have comorbidities, John. We've got to make sure that we stay hydrated during this period of time and during this particular heat wave. And actually, this is the first heat wave we've had, in 100 years or something, John?
The longest. Yeah.
The longest. It was interesting. It's very interesting. And what I think about during that is I think about all of the patients' other challenges that actually get worse in weather like this. My people who have COPD, etc. So you're right. Let's stay hydrated, and I certainly will tell the folks what we do at Innovative Medicine.
Is it a good idea to keep your air conditioner on?
You bet. And I hope if we're reaching out to one of my nurses, I hope she's putting her air on and at full blast. Okay. So yes, John, Innovative Medicine is really an interesting group. We are like-minded providers. We all work out of our primary care facility. So that means we can do anything any other primary care can do for you. So if you need a prescription, we can write the prescriptions. Our medical directors will happily write a prescription for you. If you need medication for your blood pressure, certainly we can do that. However, our philosophy is we want to use the least amount of pharmaceutical to help your challenge, keep your quality of life. In other words, what we want to do, John, is to reduce the side effects of the pharmaceuticals.
And you've always talked about hydration.
Sure.
And you've talked about it being the cornerstone of
Right.
your practice.
Right.
But why is that? Why
Because
hydration?
hydration is the vehicle by which we can get in God's ingredients or the natural substances that can actually augment prescription substances, or in some cases actually do more than that, can actually take the place of some of the prescription meds. So again, it's the hydration, the vehicle by which we're able to deliver these wonderful God-given products to allow patients to really improve their quality of life.
All right. In the case of the hydration,
Yes.
and in the case of what you talk about, the different hydration bags, so
Sure.
to speak,
Vitamins.
are vitamins,
Minerals, amino acids, natural substances, maybe some herbals. It all depends on what we're trying to accomplish for a particular patient and what brought them to us in the first place. So, yes, there's a lot of variability. All of our protocols are proprietary not only to what I do, but also they're specific, they're patient specific. So it's exactly as if the doc is giving you a prescription and he tells you to take the medication twice a day, but he tells someone else to take it once a day. We actually are doing the same thing with the natural substances, John.
And does hydration work?
Oh, yes, it does. Actually, it's interesting because right now, with all of this heat, everybody's talking about hydration, but it works phenomenally well by delivering the natural products to the patient in the dosing that's appropriate for them to effectuate the change. And it can do it rather quickly, more quickly sometimes than the medication itself.
And when you talk about the hydration,
sure,
and you talk about, that patients come in, I'm a twice a weeker, some are once a week, some are 3 times a week. What's kind of the average? What's kind of the general?
The general thing, I really can't say generally what is the protocol, because again, it's going to depend on what you're coming in for, where are you in the continuum of your traditional care, and what do you need for us. Obviously, if you have cancer, you may have to come in for the cancer supportive more often than someone who just comes in for muscle building. Yes. There's a big difference in what we do, and it's also can be age dependent, John. Come on.
Yeah. The question is, when you're talking about the hydration, and is it something that you have to do twice a week, 3 times a week? So it could be anything, right?
It could be anything. Again, it's going to be patient specific because the patient comes in, that we go through, of course, the free consult helps. The patient comes in, tells me what's going on, and then I can sort of get an idea of what that patient needs. So I would tell you 60% of our patients come in at least once a week, and the rest, it varies between twice a week, 3 times a week. It depends on what's going on. And then I have a whole gang of patients that come in once a month because they finished a particular protocol, they're feeling good, and they feel like, they just want to maintain where they are or the ending point of their particular treatment protocol. And I'm all for that. And then I have some who come in twice a month. So, again, it varies.
What about if you don't have a particular medical challenge,
right,
and you're listening to this program and you say, well, I just want to feel better.
Of course.
I just want to improve
your
my immune system, quality of life, that kind of thing.
Sure. I have patients who run the gamut from the 20s to the 90s, right? And each of them, there are people in that category who just come in to maintain well care, so to speak. So yes, however, I would say, again, it's all going to be codependent on the testing we do, on the free consult and the additional consult, and the blood work that we do. I really am very big on doing the laboratory testing to see where we are and to make sure we're not looking at any hidden type of issues, like kidney issues. I had an interesting conversation over the weekend with a particular lawyer friend of ours of the clinic. He referred somebody whose wife just went into 3rd stage kidney failure. Well, obviously, he said, I really think she needs chelation. I said, well, Stan, I think she does too. But the question is, we cannot do it in this moment. However, I would like to see what her kidney functions are. And I also want to put her on a particular probiotic that I give a lot of patients who I've seen tremendous results that they've moved from 2nd stage to 1st stage kidney, and then we were able to do it.
You often talk about supplements.
Oh, yes.
Do you talk to patients about
of course.
Taking supplements?
And we're going to talk about that a little later in the show, about something very interesting. But yes, and we want to make sure that the patients get the products that are really good products. There is a ton of natural products out there, and you and I have lived through it, John, where we've actually seen that patients have come to us and these particular products may have hidden ingredients in them, and you don't want to use them.
You mean the patients with the shopping bags?
Yes, yes.
Yeah.
Yes.
How many times have we seen that?
Many, many times. And many times they're just replicating what they need. And so, there's a possibility that they may get too much of a good thing.
All right, we're coming up on our first break of the morning. It is Health Watch. Every Sunday we're here from 8 until 9 on Talk Radio 1210 WPHT. Health Watch features Dr. Molly Fantasia. She is the PhD doctor. the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We're going to talk more about some interesting cases that came across the desk of Dr. Molly in the last couple of weeks or so. And, of course, if you have a question or a medical challenge or any kind of a thought for Dr. Molly, 855-839-1210 is our number here, 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return, more Health Watch after these words. Hi, it's John DeMasi, host of Health Watch, heard every Sunday morning 8 till 9 and again from 4 till 5 here on Talk Radio 1210. Is chronic pain or fatigue making it difficult for you, or maybe someone you know, to enjoy simple pleasures like walking your dog or spending time with the grandkids? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates offer medical hydration therapy. Their autoimmune therapy program has helped hundreds of patients to feel better and do more.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Visit innovativemedicalassociates.com to learn more about their autoimmune therapy program. Join me and Dr. Molly Sundays, Health Watch, 8 till 9 and again 4 till 5 here on Talk Radio 1210. Back here on Health Watch, operators standing by right now, as they are every week here on Health Watch at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. It is Innovative Medical Associates located in Marlton, New Jersey. And if you have a question or you want more information or you want to sit down with Dr. Molly and have the initial consultation, it is complimentary. 856-489-0505 is the number. And don't forget the website, innovativemedicalassociates.com. A lot of good information on that. innovativemedicalassociates.com is the website. And again, our show's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Our number here in the studio, 855-839-1210. And I know, Dr. Molly, you wanted to talk about people calling into the show.
Sure.
And then they speak to you in the office, or they
Right.
speak to someone
Right.
in your office. And just kind of the protocol
Right.
of what
Look,
you like to do.
Sure. You know, it's quick. Anybody can give you a quick answer and say, okay, you have hypertension and you want to control your blood pressure, go get some arginine. But, you know, here's the thing. I really don't like doing that because an example of that this week was a nice gentleman called here and I said, call the office, we'll get more specific. When I ask you to call the office, obviously we're trying our best to get you in for the free consult, but there's a reason for that. It isn't that I want to overwhelm you and start you on an IV hydration. It's because I need to get full information, because you may think you just have a minor situation with hypertension and it may be a transient situation, but really after a patient speaks to one of my nurses, in particular Barbara, she realized that she had this gentleman had serious comorbidities. And so that then, and he was pressing her for the answer. And indeed, she gave him an answer. But the problem is, you know, we don't like to really tell people this. We'd really like to get a better understanding of the condition. And the best way to do that is in the free consult. And I can rest assured this, that you do not have to sign up for a whole protocol. I am very particular. I will give you 15 minutes. That should give me enough time to see even if the hydration can work. Because you know, John, I've turned people away.
I
if
was
you have
just
a
going to
kidney
say that.
problem,
I've seen that. Yeah.
I've seen it. So believe me, folks, this isn't good to just call in. I can give you off the top of my head answers, but you know what? I'm a thinker, and I like to have my medical directors and my nursing folks there so we can throw the issue around a little bit between us.
Interesting, a couple of weeks ago, I walked in and you said to me, you don't look so good. I want to do some blood work.
Yes.
So you did some blood work and you said, I don't like this, I don't like that.
Right.
So you adjusted the hydration
exactly
based on that.
Exactly. And that's what I like. You know, it's easy for us to say off the top of our heads. You know, you go into the health food store. That's the issue at the health food store. You go in and say, hey, point me in the direction of something for blood pressure. And boy, they'll give you a whole aisle full of blood pressure. But is it the right stuff for you? This is an art. There's a particular art as well as science to utilizing the nutraceuticals. That's all.
Okay. 855-839-1210 is our number here. Again, if you have a medical challenge or a question for Dr. Molly, 855-839-1210. Lyme disease
I really
came up a lot this week.
It did. And I think because of the heat, everybody's outside in shorts, this kind of thing. So we're more prone to this. One of the things I want to talk about this in terms of the Lyme disease is several, because once the patient has the tick on them, and whether you think that tick is the tick that really you can contract the Lyme disease from, at this point, I think it doesn't matter, John, because there's so much more data coming out that this Lyme disease problem, the bacteria that the Lyme actually leaves in the body, has been found in mosquitoes, it's been found in spiders, and probably other vermin that's out there, okay, or other insects. So, the bottom line is what you want to do is probably be treated for the bite. Right away. And the treatment for that is a traditional treatment. It is an antibiotic treatment. But when you come to a place like ours, we're going to look at the entire kind of challenge. So what we like to do is look at the exposure that you might have, which will then cause an increase in autoimmune disease type symptoms and some other things. So when we look at this protocol for Lyme disease, we have a strategic combination of how we approach this. And one of the first things we do is we want to find out about any of your underlying conditions, because they can be exacerbated through this. So we may want to do some chelation to detoxify, and then we may want to use some immune support and anti-inflammatory approaches, right? We also will attack the bacterial issues and the comorbidities, the co-infections, by using traditional antibiotics. And then we have to continue to use some kind of modulators for the inflammatory immune response to these bacterial toxins. So this is not a simple thing. You come in, get your antibiotic, take it for 3 days, and good luck and goodbye.
Interesting that you're talking about this. I noticed that this Lyme disease situation can have like COVID, these long-term effects.
Exactly.
And it's hard to get rid of sometimes. So how do you address that?
Well, there it is in a nutshell. There it is. That's why the approach is very important. First of all, with chronic Lyme disease comorbidities, we know, and I think most people out there who are listening to us, John, are pretty smart, so they know it affects the brain. We know that it crosses the blood-brain barrier. So, okay, that's fine. But it also gives you aches and flu-like symptoms. It can give you severe pain, muscle stiffness, rashes, allergic reactions to things you weren't allergic to before. That's interesting. And, of course, the brain fog. What's this sound like? It almost sounds like COVID,
I was just
doesn't it?
Say,
Viral infections, right?
Right?
Depression, digestive problems, and interestingly enough, cardiovascular problems. Do you know how many people come into me and they say they're feeling like their heart's skipping a beat? They're feeling like they have some kind of arrhythmia. They may even have been told that they have some kind of inflammation, cardiac inflammation. And then when I do the digging, I find out they were treated traditionally for Lyme disease. I just had that happen this week.
So it has a variety of post-Lyme issues.
Problems, co-infections. It really has co-inflammatory issues that can really make a patient, honest to God, be so debilitated it isn't even funny. I have seen, and one of my patients, Lisa, is probably a very good example of this. She came to me in terrible shape. She's now very functional. She's working 2 jobs, but this kind of treatment does not take 10 treatments and you're done. You could become a lifer with this kind of treatment.
So you always have to be concerned that you've had it.
Exactly.
And it has those long-term effects.
Right. And the other thing is, John, here's the interesting thing. It's through specialized testing that you can find out whether you had it or not. What happens traditionally is they do a test, and if that test is positive, they say, you have Lyme disease. Well, how about if you had Lyme disease and you didn't know it? what do? You have to look for antibodies and things. So guess what? That's a little more complex in terms of the science.
I was just going to ask you, how do you know? And most likely you don't know you have it.
Don't know. You don't know. You don't know if you're suffering the effects of that. So when you come in a clinic like ours, it would be in the historical data, and then I would say, why don't we run some specialized testing? And that will tell us whether you have these comorbidities. And by the way, I want to say one other thing. In the traditional sense, even when physicians test for these specialized tests, they'll say, well, you need to show 2 analytes that are out of whack before we would say you have it. I don't believe that at all. I think, here we go again. I think you can have a subset of post-Lyme and still be really in trouble.
You remember well, he's no longer with us, Al Alberts, the singer.
Oh, yeah.
Had a TV show, the kiddie TV show for
Yeah.
years. I worked with him years ago, and this is long before you were in business. And he went 2 years and went to every specialist, every clinic, every doctor.
Infectious disease,
2 years
Yeah.
till they diagnosed him with Lyme disease.
Yeah, because here's the other thing, John. These Lyme bacterium are so smart that they can actually hide in the biofilms of biofilm, which is a coating on your cells of things like candida, fungus, and other kind of microbes. So they can hide in with other microbes. So it fools you. You say, oh, they don't have it.
Which is why it's hard to diagnose,
Exactly. That's why I said, even if you don't test positive for the analytes, I'm still going to be looking.
And you do look. When
Oh,
you do,
boy,
when
I
you
try.
do blood work,
Now,
I know you look.
And I try not to use patients' money foolishly in blood work. But there are some times when you really have to look at finding the underlying cause of all of their challenges, because their challenges are really, really wreaking havoc with their quality of life.
So what do you recommend? Stay away from
Listen,
woods?
Listen, I recommend, like everybody does, you got to put on some, some type of spray for the bugs, this kind of thing. But you know what? It's almost impossible. Today, these critters are everywhere. It used to be, right? We didn't have them, but now we do. And I think the warmer the winters, we're seeing it. And so it's a year-round problem. That's the other thing, that many physicians don't believe it's a year-round problem, but I've actually seen it during the winter when they've had a tick bite.
So it's not a seasonal problem?
No longer.
Okay.
I don't think so. I think it's a persistent problem. And if you look on PubMed, you will be surprised how many articles are coming out showing that this thing is running crazy in our country.
All right, we're coming up to our halfway point of the show, which means you still have plenty of time to call in if you have a medical challenge or a question for Dr. Molly. 855-839-1210 is our number here, 855-839-1210. Our show is Health Watch. You'll find us here every Sunday from 8 until 9, our live version here on Talk Radio 1210, WPHT. Again, the number here in the studio, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We both return. More Health Watch, today's edition, after these words. And we're back here on Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates. And the number is 856-489-0505, 856-489-0505. When you call, and you heard Dr. Molly talk about calling the office, when you call, certainly what you want to do is make the appointment for the initial consultation with Dr. Molly, and that is complimentary. And all you have to do is call that number, 856-489-0505. Call that number right now, or you can call it after 9 o'clock. Operators will still be there. Or you can call during the week, 856-489-0505. And remember, the website, innovativemedicalassociates.com, innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, the live version here on Talk Radio 1210, WPHT. We're going to the phones right now. Joanne is in Mount Laurel. Joanne, good morning. You're on Health Watch. You're on with Dr. Molly.
Hi, Joanne.
Hi, Dr. Molly. I have what I believe is an autoimmune situation, but it's
Sure.
EMT. I don't know if you have any experience with this. It's very rare. It's a Paget's disease of the vulva. And
Yep. Oof.
but this for 20 years, and currently I'm on an immunotherapy, Keytruda, but
yes, good.
The slow internal healing is not worth the risk. So I'm only going to have two more of those treatments. So I'm now researching what to do after that. And I've come up with, a lot of this hydrotherapy and diet and vitamin C and
vitamin C you know what I want to say, Joanne? Vitamin C, without a doubt. There's no question. I think there's a lot of literature on that. And I think they're talking about dosing vitamin C as in the kind of dosing you can do through hydration. But the condition you have now, but I will tell you, Keytruda has gotten some good results. Keytruda has gotten some, but go ahead, dear. Go ahead.
They don't think it's doing the job I need it to do, and the risk isn't worth it.
Sure.
They don't want to damage my internal organs.
I can appreciate that. Yep.
Okay,
yep.
So I'm only going to have 2 more treatments. But,
okay.
Somebody is advised. I belong to a group, and they're doing potentation therapy and detoxifying the body.
Yes.
And
yes.
Hydrotherapy, and I don't know what fever bath or contrast showers are. I mean, they're throwing all this stuff at me.
Sure.
But
sure.
Vitamin C and D and magnesium, and I take all that internally, but talking.
This is you know what, dear? It's a very interesting thing because what you're saying to me, yes, all the nutraceuticals and things that you were mentioning do have a potential to help you. But the question is, what's the therapeutic level? So you really present a very interesting case. You're not that far from me. You ought to come in and talk to me, and I'd be very interested in the history of your condition and maybe some of the facts, some of the notes that your physician has written. I'm sure my medical directors and I would love to take a look at this. So, it's a free consult. You ought to come in and see us. And thank you for this call. It's a very interesting thing, Joanne. Thank you. Thank you. She's got some challenges, John.
All right, let's talk to George in Maple Shade. George, good morning. You're on Health Watch. You're with Dr. Molly.
Hi,
good
George.
Morning, John. Dr. Molly, my wife and I saw you this week. She is a patient with MS.
Yeah, hi George. How's she doing on our subclinical dose of that particular product? Is she? Thank
Amazing.
God.
Yes,
I have to tell you, George, I've been really praying for you. I've really been thinking about this. I hope she's coming in Tuesday to talk to Dr. Cassican.
We were going to come in Tuesday, and my schedule couldn't allow it, but I am coming the following Tuesday. Yep.
Super.
Yep.
Super. I think you will be pleasantly surprised. And I would really love to get her on a course of hydration therapy as well.
Exactly.
Because she needs these nutrients. There is no ifs, ands, or buts. And I want to. Am I allowed to say that you are a pharmacist? Because I'd like to tell people that you're a smart guy. Okay, you're a smart guy.
John, I was looking for John, Dr. Molly. I was looking for you, John.
Oh yeah,
I was there, wasn't I?
Yeah,
Tuesday?
yeah.
I was
but
there.
you know what? He came in later than you. John's always in a hurry, man. He's got a lot to do. You know that. He's a big VIP. I feel grateful that he's my spokesperson because he's a busy guy talking about the politics of the nation. Yeah.
Guys, I would just recommend the listeners come and talk to you. It's one thing calling in, but when you sit and talk, you spent so much time with us, never rushed, didn't push us to do something, but gave us so many options and so many ideas, and even said to us, research this, look into this, all right?
Yes,
But I really recommend anyone just go in and talk to you, really. I
Thank
really do.
you. Thank you, George.
Well,
That's
George,
how I feel. I feel you guys are an integral part of the healthcare system. The pharmacist, I couldn't do it. I couldn't do what I do without the special relationship I have with my two pharmacists, because you guys are the backbone to what I do as well.
Yes.
God bless.
Thank you.
God
George,
bless.
1 o'clock on Tuesday. That's when I'm there.
Yeah. Okay.
All right, guys. Thank you so much.
Thanks
Dr.
for
Molly.
the
Thank
call.
you. That's a great call.
All right, 855-839-1210. That's our number. Yeah, they were in this.
Yes,
week. I remember
and I will
it.
tell you that MS situation, I started her. You know how I believe that sometimes we need traditional drugs. I started her because her husband was a pharmacist. I said, let me take the giant leap here. I said, how would you, because I was secure that he would be able to manage, the subclinical dosing, and indeed he did. Very, very important. I want people to know we try to do combination of things. We're not just throwing vitamins at you and saying, oh, we're sure this is going to help. I really want to research your condition and make sure it helps. And by the way, our Dr. Pat, reason why I talked about Lyme disease today was that Dr. Pat came in on Tuesday and had a tick bite. And she said, I don't think it was a deer tick. And I pulled out all the research showing, forget deer ticks. You have MS. We're finding this bacteria in all these other little vermin things. Guess what? Let's do the protocol and then shoot back to the MS protocol.
And that's what you did.
Exactly.
So it's not just in deer. It
No,
could be,
the deer tick.
Spiders, mosquitoes.
Yeah, I mean, it's like unbelievable what they're finding. And actually, if people go out and look for this, you're seeing more and more cases. So it's there. All right, John.
All right, 855-839-1210. That is our number. I just want to mention we're coming up on our final break.
Sure.
I wanted to mention, being the hottest day of the year today,
yes,
your line of skincare products, and you go to the website, innovativemedicalassociates.com. Your sunblock, it's a 47.
It's doing
and I've
it.
been using it.
It looks good, John.
And it's interesting because
you're tanning, but you're not burning.
You're not burning.
Right.
And I've used it.
Yeah.
And in fact, Ellie, your esthetician, told me to use it every day on the face, which
I've
done.
Yeah,
and I don't have any burn marks at all.
I have a convertible and I'm using it.
Right.
You see me.
Right.
I have a little redness, but I'm not burning, and I'm applying it a couple times a day.
So what you do is you go to the website, innovativemedicalassociates.com, and you look up Dr. Molly's line of skincare products, great products. I'm out of the eye cream. I have to get more.
Okay, it's cool.
on Tuesday.
Well, we have to make you look good,
Right, exactly. So that's what, you were telling George about, what I do, but thank you for that. But, innovativemedicalassociates.com is the website, and check it out, Dr. Molly's line of skincare products, all natural.
Absolutely.
As you would expect. Okay. Jim, we're going to break a little early here, and then we'll have our final segment. It's Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number, 855-839-1210. You have a question, you have a comment for Dr. Molly, feel free to call in at 855-839-1210. We still have some time to take your calls. We have one more segment here on the show. With Dr. Molly Fantasia, I'm your host, John DeMasi. More of today's edition of Health Watch after these words.
Hi, it's John DeMasi, host of Health Watch, Sunday mornings at 8 and again at 4 here on Talk Radio 1210. Have you or someone you know been diagnosed with cancer or breast cancer? Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates can help. They offer medical hydration therapy. Their cancer support program is designed to reduce chronic symptoms often associated with diagnosis or treatment, including pain and fatigue. Dr. Molly's unique protocols have improved quality of life for hundreds of patients.
I want to help you heal. I want to help you have a quality of life while going through cancer treatments.
Visit innovativemedicalassociates.com to learn more about their cancer support treatments. Join me and Dr. Molly when we discuss the benefits of medical hydration and more on Health Watch every Sunday morning 8 till 9 and Sunday afternoon 4 till 5 here on Talk Radio 1210.
Welcome back to Health Watch. Operators standing by right now at Innovative Medical Associates. And if you want to contact them, you want to get more information, and most importantly, you want to make that appointment to sit down with Dr. Molly, you call 856-489-0505, 855-839-0505. That's the number. It's Innovative Medical Associates, Marlton, New Jersey. You can call right now. You can call after we leave you at 9 o'clock. Operators do not go home. They'll work all day. Yeah, they'll work in the heat, but they have air conditioning rooms. So, they're in good shape. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget, if you miss any of today's show, you miss the live version, we have our Health Watch replay Sunday afternoons 4 until 5 here on Talk Radio 1210 WPHT. So you can catch it again, or you can catch it in case you missed it. We do talk to a lot of folks who say, you know what, I sleep in a little bit on Sunday.
Yeah,
so we call that our sleeper special.
That's right.
Our 4 o'clock version, all right?
That's right.
855-839-1210 is our number here in the studio, 855-839-1210. We still have some time if you want to call in. You have a question for Dr. Molly. And this is an interesting topic, Dr. Molly, because I never heard of this, and I know you wanted to bring this up.
Sure.
Vitamin D intoxication.
Yes.
What is that?
Well,
is that like
let's
too much
vitamin D? But
Okay.
let's really talk about vitamin D in general for the first part. This came to my attention from a colleague of mine who is doing a study on vitamin D, and he sent me some information about it, and I found it quite interesting because in our facility, for the most part, we've seen nothing but low vitamin D. But he actually ran into a physician. He's a scientist, a bench scientist, and he ran into a physician who sent this sample to him because the patient's blood work was sent out, and they had a vitamin D level of 510 on the scale, and it was done in a traditional clinical lab. That's pretty high. I've never seen it that high in the whole time I've been in with this facility. But it turns out when the doc did the history on this patient, what they found was he was taking a particular brand of vitamin D. So they sent the capsule to my friend who runs a clinical lab as well, and he analyzed it, and here it was mislabeled. So he was taking, instead of 5,000 vitamin D3 and K2, he was taking 25,000.
Whoa.
Daily, okay?
Whoa.
Plus hanging out in the sun. So the point I wanted to make with this is that it goes back to my theory of the Goldilocks theory, right? Just right. You don't want too much. Now, Dr. Molly, by the way, has a vitamin D level that was just done this week of 175. Now, that is approximately 25 points higher than the level that is alleged normal. But that is not intoxication. We're talking about levels of 400, 500. That's the levels that we're looking at. So the other interesting thing about this is just think about that. If you get a brand X vitamin, let's say something from China or somewhere else. I don't want to pick on China, but anywhere, right? How about if it's mislabeled, John?
Then you've got a problem.
And you don't know.
This goes back to what you've often talked about with health food stores and getting product and not knowing what's in them.
How about getting it off of Amazon? How about getting it off of the internet? How about all this?
Yes.
You are so right. And that's why it's so important to get good quality, oral products. And, I'm a big believer in some. We don't sell them, but I'll tell you, you really want to use the right stuff. What is also interesting is, guess how they remedy, vitamin D intoxication?
How do they remedy that?
They use a hydration protocol. And that's the key. But I really want people to get this, that we're right back to what I say. And in order to really say that you have high vitamin D, you would want 2 standard deviations from the 100. So that might be 300 or 300 or 400. It might even be as high as 400 or 500. I can honestly tell you that in 26 years, I've never seen anyone who's had too much vitamin D. I've seen many patients who've had too low vitamin D. So again, I want to really stress that it's important to get a good quality product, to use it appropriately, and we don't want to do too much of anything, John.
Why is vitamin D important?
It's very important for immune health as well as bone and hormonal health. It really, really is an important. It's an important nutraceutical.
And you've recommended I take vitamin D, and
yes,
do every day.
I do. And people who have, let's say, autoimmune disorders need to take up more. But again, the question is, you want to take it with vitamin D and the K vitamin because you want it to go to the right place. You don't want it just floating around. That's the point.
All right, couple minutes left of the show. 855-839-1210, our number here. We do have time for maybe one more call.
Good.
I know you wanted to talk about this particular patient, Rich.
Oh yeah, Rich.
What's the situation?
Well,
there?
I want to say that's my nurse, Lana's husband, and we were very concerned because he has several comorbidities, and I was very concerned because he went to a dermatologist who said he absolutely had to have several of these melanoma spots removed from his head. But he was very concerned that, of course, it had spread to all the other areas. Well, we sent him out for a CT and also CT PET scan from a very prestigious university. He went back. That was negative, so it showed that the melanoma had not spread. So there was a good chance it could be extracted locally, so he didn't have to go under general anesthesia, which was a problem for him. So interestingly enough, he went to another practice, also at this wonderful institution. The gentleman who took it out was a great doctor who trained under a doctor I knew very well. And he said, wow, you did really well. And they were able to remove the melanoma locally and not put the patient at additional risk.
And that's kind of your philosophy that you have
always... everything.
Right, exactly. So had he gone through with what the other guy said...
I think he would have been at grave risk, and I'm not sure the risk would have been worth the reward. In fact, I know it wouldn't have since the melanoma hadn't spread. So, I mean, here's the thing, folks. When you get a dastardly diagnosis, you need to get second opinions. How you get the second opinions, we can help. We absolutely advocate for our patients, all of them. And you know that's true, John.
Absolutely.
And that's the big deal.
And you said earlier in the show that more and more people are taking charge of their health. I hope. And that's a good thing.
It is a good thing.
Particularly your patients, because I mean, they're thinking outside the box, and they're also thinking.
Right. And the point is, you can't just, here's our problem. What happens is we get a dastardly diagnosis and we get in inertia. And inertia is the worst thing. We've got to do something. You've heard me say this a million times. If you get a cancer diagnosis and they can get it out, get it out. And, then you can take the time to figure out what you want to do in addition. And that's what I love about all my patients. They're thinking people.
And you told me many years ago I had a challenge, and it required surgery. And you said,
let's get it out.
Let's get it out. It's got to be done. And thankfully, I've been treated ever since.
And it's under control. And you know what, John? That's true for chronic conditions. That's true for cancer diagnosis. And actually, I believe that patients today need an advocate no matter what. And I'm not talking about a navigator. I'm talking about an advocate who doesn't have loyalty to a particular system.
Okay. And with that, we put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical, and they'll be there well after we leave you at 9 o'clock, 856-489-0505, 856-489-0505. And don't forget the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. And don't forget, if you miss any of today's show or you want to hear it again, we have our Health Watch replay this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Jess, Catherine, and Lana, we have delightful Dee, fabulous Fran, and also Joanne, and our medical assistant, Karen Kathy. I'm your host, John DeMasi. Thank you for listening. Stay cool. Have yourself a great week and a healthy one. We'll do it all over again next Sunday. Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.